they will start. So there are mainly 4 preparations in Rasashastra. Okay. Kalvi Rasayana. So that is in many diseases and prepared out of Kalva. So that's why it is called as Kalvi Rasa. So next one is quarterly Kalpanas, Parpati, and Tupipak. Okay. So today we'll start with Parpati Kalpanas. We have a reference of Parpati in early books of Rasashastra, but we don't have any detailed preparation methods and indications and Paka Lakshanas. All those things was not mentioned in earlier granthas of Rasashastra. Maybe it's not available. So today. But first detailed reference of Parpatis, we will get it from Chakrapani, book Chakravat. Okay, detailed explanation of Parpati Kalpanas with their manufacturing procedure, preparation procedure, everything is available in Chakravat. He is the first author to mention the detailed preparation of Parpati Kalpanas, Chakravat. So one common thing we should know about in Rasashastra. So any Paka Lakshanas, Paka Kalina Lakshana, Paka Paschat Lakshanas, Paka in preparations of Rasas means it must be in Parpati. Okay, that question will goes in the topic of Parpati. So any other in other preparation we don't have any of these Lakshanas. In, for example, in Kupipapa, for example, in Kalvirasanas, there is no Paka, Paka Kalina, Paka Paschat Lakshanas. So if they ask question like Paka Kalina Lakshana and other things, so you should remember it is definitely a Parpati Kalpana. So one question was asked in 2009 question paper, AAPGT, Kannada PGT. So Paka Kalina Lakshana. So in Mrudupaka, how it will appear? So in Paka Kalina Lakshana, Mayura Chandrikavat Varna. The Paka will resemble like that of Mayura Chandrikavat Varna. Mayura Chandrikavat Varna, Mrudupaka. Madhyama Paka, Taila Varna. Madhyama Paka, Taila Varna. Karapaka, Rakta Varna. Karapaka, Rakta Varna. Okay. So Mrudupaka is Mayura Chandrikavat Varna, or Kajali Varna is also explained in some other granthas. Madhyama Paka is Taila Niba or Taila Varna. Okay. Karapaka is Rakta Varna. Right. So Paka Paschat Lakshanas. So already Parpati is prepared completely. So whether you know whether this Parpati is a Mrudu Parpati or Madhyama Kara Parpati. So for that reference, so Mrudu Parpati will not cut easily. So just like a green stick fracture. So it will be happening in children's. So in children's, bones will not cut just with a sharp edges. Okay, so it will bend or else it will give the remnants after cutting. So that is green stick fracture. So just like in Mudupaka, Nabyante, it will bend, but it won't cut easily. So Madhyama Paka, Bhagnat Raupyat. So with sharp edges, it will cut. If Parpati is prepared of Madhyama Paka, with sharp edges, it will cut easily and with sharp edges. Okay. Karapaka, so it will become a powder, Loha Chuna. So completely it will cut and it will become a powder like appearance. Karapaka. Okay. Loha Churna, the Karapaka. So many pieces. Cut into so many pieces. So Paka Kalina Lakshanas and as well as Paka Paschat Lakshanas. And Parpati Kalpana's main action, the main area these Parpatis will go into work is in Grahani Gada, or else in Pachana Samsthans. So all of intestine from mouth to anus is GI tract, The main action of purpati will be on GI tract. We have a lot of diseases pertaining to the GI tract, starting from abdominal ulcers to ulcerative colitis and C intestine. So in all cases, we can utilize purpati. Purpati is having a very strong affinity towards gastrointestinal tract, and it will work better in these areas. So in all of the Rasashastras, so easily available drug and cost effective, and we can give it to the particular disease is purpati. Nowadays, irritable bowel syndrome is too high. Inflammatory bowel syndrome also will get it. Colitis you will get. Ulcerative colitis you will get. Crohn's disease is very common. So ulcers, peptic ulcers, duodenal ulcer, esophageal ulcer. Okay. So in all these cases, you can utilize purpet as a main drug of choice. Okay, it will do well also. Purpati, one more thing we need to remember while using purpati. Purpati should be used arohana and avarohana krama. We should start with one rati, then increase to 2, 3, 4, 5, like that. We should increase up to 10 ratis. Again, we should taper the doses. Arohana and avarohana krama. So this is the one thing we should remember while giving the purpati. And one Vaidya, and it is documented also, and it's published in many articles. So Parpati highest use they given up to 5 grams in a single day. So and they studied nephrotoxicity, renotoxicity, nothing was happened. After 20 days, after 45 days also, they have checked about nephrotoxicity and renotoxicity, and nothing was found. Okay, so they are used Loha Parpati for one course and then Swarna Parpati for second course. So this is a serious case of irritable bowel syndrome. So usually in irritable bowel syndrome, patient used to eat with a comfortable space, and the area should be attached with a toilet. So soon after food intake, they have an irritation. They should go to toilet. They should defecate, and it should be a painful defecation only. So some people will complain about after taking the food, I will have an urge to defecate without pain. That is not an IBS. IBS is always associated with a spasmodic pain. Okay, so with pain only, patient will go and defecate without any other option. Don't have any other option. You have to go for a defecation. So that is IBS, irritable bowel syndrome. So in Crohn's and all, it is an autoimmune Crohn's. So usually some part of intestine is completely inflamed, and part by part it will going to decay. So it's a very severe condition. So one area I have seen with completely a naturopathy medicine. Naturopathy, there is no medicine like, so completely a diet. Only 2 meals in it, only banana and like that fruits, and they will give you some sorted material. They will admit the patient for 15-20 days for IBS to place in Tamil Nadu, some ashram. Okay, so only the food they will fix. There is no salt, pepper, no masala, no kara, katamita, no. Only with some food stuff they will give you complete relief from IBS. Okay, that is the one area. So we can also do patya. Patya is the main thing. So here patya means that is compatible for the diseases. Patya means that food or any item that will going to increase the disease. Here patya is not anupana. That you don't confuse with patya and anupana. And people will ask you, Ayurveda doctors, so in your medicines there is a lot of patyas we cannot follow. That's why we will not come to Ayurveda and we will not take Ayurveda medicines. It's not like that. Even patya is there for every disease and every system of medicine. It's not stick to the Ayurveda. Okay. So if you do apatya again, disease will increase. Even at a time of fever, if you consume some heavy meal and oily food and fried food, again fever increases. Even after taking paracetamol and antibiotic, also fever won't decreases. Okay, so that is patya. Patya is the one that will uh, decrease the disease condition. Apatya that will going to increase the disease condition. Patya and apatya is not for our medicines. Patya and apatya is for your disease. You should explain and you should convince the patient. Patya and apatya is not for Ayurveda medicines. Patya and apatya is there for your disease. Anupana, I will agree. So we will prescribe some particular anupanas for particular diseases. Only we should take with cold water. Otherwise, you should take with only hot water. Otherwise, you should take with the kashaya, or you should take with aswarishta only. So like that, I will advise. That is acceptable. So that is mandate rules we can give it to the patient and partners. But patya and all, you won't agree with the people. Patya is only for their disease, not for our medicines. In Amavata conditions, if they going to consume continuous Shita Ahara Vihara, again disease will increase. Okay, with very good medicines also, disease will aggravate. With some seasons, disease will aggravate. Okay, it is part and parcel of Amavata. Okay, so in that cases, Patya role is very high in autoimmune diseases, chronic diseases. Okay, so Patya role is very important. Okay, and Parpati Kalpanas is one of the Parada Bandha. It's called as Kota Bandha. You just make a underline Kota Bandha, KOT, Kota Bandha. Parpati Kalpana is also one of the Parada Kalpana, and it's a Bandha. So one type of Bandha. So it is Kota Bandha. In question paper, if they ask which is the patras used to prepare parpatis, Kadali patra, it's very neatly mentioned. After boiling, after attaining the paka, we should press the parpati in Kadali patra by applying ghee over the Kadali patra. So just like the preparation of sweets, you know how to prepare the sweets. So just like the sweet preparation, the parpatis also can be prepared. So very easy to prepare and easy to administer parpati kalpanas. But ingredients is a bit difficult. Kajali, already we have to prepare kajali. Then directly you can go and prepare parpati kalpanas. First one is rasa parpati. So parada, gandaka and gruta, only three ingredients. So it should be administered with arapana, avarapana. You should start with samanya dose, samanya matra of parpati kalpana. One rati you should start. You can increase up to 22 ratis. So one mandala kala you can give. In some references, first 10 days we should increase the dose, and then we should continue the same dose till the cure of the disease. It's also one reference is there. Then we should slowly taper the medicines. So that is also one reference. So indication is grahani, and patya they are advising is shalidanya, gruta, jeera, purana shali. Shali means purana shali only. Very clearly explained in Swastarata, Shali, it should not be older than that of 2 years. Okay, it should not be new than that of 1 year. It means to say that after 1 year, before 2 years, we should use Shali. After 1 year of harvesting and before 2 years of harvesting, we can use Shali. Purana means 1 year old Shali. Namadanya again that will go into aggravate kapha, kapha dosha in the body. So Purana Shali is it won't aggravate any disease easily. Even reciprocity is indicated in Kasa, Jalodhara, Harsha, and Kamala. Okay, so it's also indicated in Kasa, Jalodhara, Shota, Harsha, and Kamala. Next is Loha Parpati. Here ingredients are Parada, Gandhaka and Loha Vaspa. Equal part. Parada, Gandhaka and Loha Vaspa. So the main indication is Grahini, again Sangrahani. So apart from that, it contains Loha. The main indication apart from Grahani is Pliharuddhi, Raktakshaya. Okay. So Raktakshaya and Pliharuddhi. Iron deficiency anemia, we can use this medicine. And a very common symptom in iron deficiency anemia is splenomegaly. Just check the reports. So if hemoglobin is below 8 or 7, just go with USG. Definitely splenomegaly will be there. Any iron deficiency anemia definitely will get splenomegaly. Okay. So Loha Parpati can be used in Sangrahani, Atisara, Sandu, Kamala, Raktarudhu, and Iharud. So first and foremost indication is Grahani. Next, we should go with Raktarudhi and Pliharuti. So sometimes you can it will also work in Adisara, Pandu, and Kamala. So iron is one of the key element to maintain the health of a liver. Okay. So in our classics, Kamala and Pandu explain the same chapter. First is Pandu, then they will explain about Kamala. So just go with the biochemistry of the liver. So iron is one of the key enzyme helpful in activities of the liver cells. It is present in the cells of the liver, hepatocytes, present inside the hepatocytes. It is acting as a coenzyme in many preparations, in many functions of liver. So that's why our acharyas clubbed Pandu and Kamala and they explain. And in the treatments of Kamala also, they are given the same medicines. Whatever the Pandu medicines, it can be also used in Kamala. Okay, and our explanation, our basic explanation is after Pandu, Kamala will come. Okay, even in Nidana also. So once the Pandu patient indulge in Pittal Ahara and Vihara, then Kamala will come. Okay, so that is the explanation given in our classes. So Pandottara Kamala. So in that case, iron and iron related preparations are best of choice. Okay, Loha and Loha preparations. So next is Swarna Parpati. So Parada, Gandhaka and Swarna. Parada, Gandhaka and Swarna. So Parada is 50 grams, Gandhaka 50 grams, Swarna 1.5. Usually wherever the Swarna is used in the medicine preparation, always the dose is less only. Okay. So 50-50 and 50. 50 grams of Parada, 50 grams of Gandhaka and 15 grams of Swarna. So here the indications goes with Sangrahani with Kshaya. So Swarna is a Rasayana. So always Rasayana Aushadhis will be used in cases of Kshaya, Kshatakshina conditions. Datakshaya. Okay. So Sangrahani with Kshaya, Atisara, end stages of Atisara, Arsha, and it is Russia. It's a Russia. And even they are given a Pravahika also the indications. So we can imagine, we can compare to the modern inflammatory bowel disease, chronic amoebiasis. Okay, so in that conditions also we can use Swarna. Datakshaya. So Grahani with Datakshaya. Next, Tamra Parpati. Tamra, Parada, Gandhaka plus Vatsanava. Tamra, Parada, Gandhaka and Vatsanava. Tamra, Parada, Gandhaka and Vatsanava are the ingredients. Okay. Here in Tamara Parvati, instead of Kadali Patra, they are using an Arka Patra. Arka Patra instead of Kadali Patra. Here the Patra used is Arka Patra instead of Kadali Patra. Vatsanava is one of the key ingredients. Tamra, Parata, Gandhaka, and Vatsanava. So main indication is Kasa Shwasa and Dahana. Kasa Shwasa and Dahana. Yakrut Pliharuddhi. Yakrut Pliharuddhi. Vatarakta. Pandu and Shota. Yakrut Pliharuddhi. Vatarakta. Pandu and Shota. Okay. Panchamrita Parvati. Panchamrita Parvati. Tamra Parvati having done good affinity towards respiratory and as well as liver. Yakrut. Okay. So Somanati Tamra Basma is a one preparation used in case of hypothyroid. Okay. So these medicines can be used in hypothyroid. So in hypothyroid, whether two conditions can be ascertained. So Datvagni mania related one. So and then Panchabhutagni mania. Panchabhutagni mania is liver toxicity or liver metabolism related issue. Uh, Many a times, hypothyroid is 80 to 90% is associated with the liver functions. Okay, stressful life, so fatty liver, impaired liver functions that will lead to hypothyroid. So you know about T3, T4 hormone. So you know anti-TPO enzyme, Thyrox anti-TPO enzyme that will going to convert T3 to T4. Okay, if this action is not proper, then TSH will increase. Okay, here the pathology will be in the liver. This anti-TPO enzyme will be produced from liver. For thyroid, we have to treat liver, not directly the thyroid gland. In allopathy, their treatment protocol is fixed. There is no medicine. We cannot correct your thyroid gland. So we will do supply of thyroid hormone. That is hormonal replacement therapy. They will do in modern. So if thyroid TSH is increased and T34 is decreased, it's a hypothyroid. Very common in hypo and hyper is hypothyroid is very common. 90% of people will suffer with thyroid disease means hypothyroid. Okay, here they won't check whether there's a problem with the liver or problem with thyroid gland or any problem with any obesity or other hormonal imbalances. No. So their treatment protocol is fixed. They will give only hormone, thyroid replacement, thyroid hormone replacement therapy. So your body will not going to produce sufficient amount of thyroid hormone. So you can consume extra thyroid hormone from outside. Their intention is very clear. In your home, you are not able to prepare the food, so you should consume or you should purchase food from outside. They won't try. Even in the home, why the food is not prepared? Maybe the shortage of grains, shortage of fire, gas, or anything. They don't think about all those things. But indirectly, they will replace hormones. What happens once hormone therapy was started? When some amount of thyroid hormone is produced from the thyroid, also will going to stop. Body will think, why I should produce thyroid hormone? Easily I will get the hormone from outside. Why I should prepare? So it will go to a negative feedback mechanism to the brain. Brain will going to stop extra production of thyroid hormone from the thyroid gland. So permanently that patient will become a hypothyroid patient. Becomes permanent. Okay. So that is the case in case of hypothyroid. Usually what they will do with hyperthyroid. So there are two line of treatments they will do in hyperthyroid. One is one tablet they will give in neomercazole that will control the activity of thyroid. So in overdose, that thyroid gland will going to stop producing hormone completely. T34 completely stop for some years of pneumococcal, or else they will directly give some toxic medicines to thyroid gland that will going to stop all the functions of thyroid. Then the patient becomes hyper to hypo. Then treating hypo is easier to compare to hyper. They will convert hyperthyroid patient into hypothyroid patient. Okay, for hyperthyroid, they don't have proper medicines. Only the one or two drugs are the neomarcosol. So that will going to subside thyroid hormone, production of thyroid hormone. If it is overproduced, and again thyroidomegaly and other things will come. So to avoid all those complications, they will stop thyroid activity by giving some toxic drugs. Ajida is a nuclear medicine. They will give you some nuclear medicine. They will stop the activity of thyroid. Then hyperthyroid patient will become some hypothyroid patient. You know how we have to deal with thyroid patients. That is the role of an Ayurveda physician. We need to find it out where exactly the problem is. So whole body is having an Agni everywhere. So whether it is in the problem with the Dhatva Agni or Panchabhuta Agni or the level of thyroid, whether the obesity is the cause, any hormonal imbalances with the menstrual hormone imbalances, whether stress is the main cause, we need to find it out. So according to some expert opinion, thyroid is a gland. It acts as a shock absorber between body and mind. If extra pressure there in the mind, it will transfer into the body, and if it is there in the body, it will transfer into the mind. And this thyroid hormone will balance by producing proper hormones. Okay. So if this continuous pressure happening in the brain, especially in female category, so they have to work in the home also, and they have to work in the office also. Double burden. Along with they have to take care of their kids. Triple burden. In meanwhile, they will forget to maintain their own health. It is the fourth burden. Then the thyroid will start. In metro cities and those who are working outside working women, so 1 in 5 will suffer with hyperthyroid survey. So 1 in 2 they suffer with PCOD. PCOD becomes 50%. Thyroid becomes almost 1 in 5, 20%. So that is the ratio of thyroid and PCOD in female. Compared to the male, it's very less. 1 in 10. When come to the male population, it's not more than 10%. Those are suffering with hypothyroid. So in male, definitely there is a chance of hereditary, some patients, or else overstressed, no proper sleep, this type with all these things. Those who are doing night duties continuously, continuous night duties, 1 year, 2 years, 3 years. This is associated with thyroid in male patients. In female patients, overburden, overstressed, hormonal imbalances, obesity. Okay. So when you are a physician of Ayurveda, when patient comes to your clinic, you need to find it out what is the exact cause of the disease. Nidana, we need to find it out. And first and foremost treatment will be Nidana Parivarjana. In Kriyakala, Pradama Kriyakala Chikitsa is what? Nidana Parivarjana. Nidana Parivarjana is 50% of the treatment. Nidana Parivarjana is Chikitsa. You should avoid Nidana first. Then you can think of curing the disease. Then if you give some medicines to increase Datva Agni, and if you do Shodhana for liver, so then it becomes easier. The best drug of choice in hepatotoxicity and for Datva Agni Manja is any accumulated toxins in the body is Pagyordhini. So main drug of our action in Aragyordhini is Katuki, 1/18th part. Okay. So Pitta Rechan action will be there in Katuki. So stagnant Pitta will come out from the liver. Then the action will be similar. So the action will normal. Liver functions, everything will be normal. Okay. And one rasayana we can give. Kanchanara is the best drug having an affinity towards uh, thyroid gland. Kanchana. It's a rasayana for thyroid gland. It will rejuvenate thyroid gland. One medicine we are using for detoxifying the liver and detoxifying all agnis in the body. So one medicine act as a rasayana. And if you feel patient is having an obese, Meda Dhatu Vikruti is there, then we can choose Varuna. Varuna Digana Kashaya, Varuna based drugs. Or else we can take Shilajitu well from the Shilajitu Rasayana. Okay. So with these 3-4 medicines we can treat. If Rasadhatvagni Mandi is there, we can go with Rasapachakas, Raktadhatvagni Raktapachaka. So like that, Dhatapachana can also be done one by one. Along with Sarvadhatapachaka is Arogyavardhini. And Sarvadhatu Pachaka along with Rasayana action, if we expecting means Tapyadiloka. So Aragyavardhini and Tapyadiloka having the same functions. So here in Aragyavardhini, Pitta Rechana action will be more. So it won't act as a Rasayana immediately. But in Tapyadiloka, so it will act as a Rasayana also Rechana action. Both actions can be expected from Tapyadiloka. It's very good Rasayana. It contains ropia. Okay. So liquid toxins will be eliminated from the body by Tapalilo. And one more, if Rasa and Rakta Vikruti is there, then we can use Sariva. Sariva is the best drug of choice in case of hypertension. Sariva, Sariva Dhyasava, or Sariva Ganavati, or Anantamula Ganavati. The best drug of choice. Rasa Rakta Mamsameda. Up to 4 dhatus is involved, and Datvagni Mandya will be there in the liver. We need to correct Datvagni Mandya and Dhatu Shodhana. By all these things, it will be get corrected. So when we have to do all these things, means patient comes to your clinic very in an early stage. If completely thyroid shutdown has happened and they are completely addicted to 100 to 150 mg of Thyronorm or ultraxin medicines, then it becomes a bit difficult. Then we can try with our medicines and then we'll think about it. Okay. So here we need to think about whether the problem is Rasadatvagni, Raktadatvagni, Mamsa or Meda. Okay. Along with GIT, liver. And you should think about all the symptoms in thyroid. Whether having any acidity, almost all symptoms is present in thyroid. Lethargic feel, air fall, palpitation, irregular menstrual cycle. So weight gain, weight loss, okay, skin dryness, itching. Many patients will come to the clinic by itching only. After testing only, we'll get it's a thyroid patient. Continuous itching, it won't subside by any other medications. Hypothyroid. Okay. Continuous weight gain without any other things. Thyroid. Air fall, thyroid. So lack of energy, thyroid. Insomnia, thyroid. Acidity, thyroid. Skin problem, thyroid. Constipation, thyroid. Okay. So palpitation, excess of palpitation, hemoglobin will reduce in thyroid. Okay. So these are all things will associate with thyroid. Whenever the patient comes to your clinic with hypothyroid, you can able to analyze the symptoms and prescribe medicine accordingly. I have given complete insight about thyroid. So 10 to 15 minutes ಹೇಳಿದ್ದೇನೆ. We have treated more than 5,000 patients of thyroid. We have stopped almost medicines in 3,000 patients from last 12 years. So it's not a big deal, but the approach is important. How, in what way we should approach the thyroid is different. So simply by prescribing some patent medicine is not a treatment according to our acharyas. We need to enter inside the patient. Rogir pravish anupravesh tadanantaram chikitsa. If you can able to penetrate inside the Rogi Atma, then only you can do the treatment. Otherwise, don't. Charakasana. Reference. Okay, next is Panchamrita Parpati. Parada Gandaka. Abraka, Loha, Tamra. Pancha means five only. Parada, Gandaka, one part. Abraka, Loha, Tamra, one part each. So here it can be advised from 1 gunja to 10 gunja. So abraka is the main ingredient here. It can be used in case of Pandu, Shwasa, Amlapitta, Atisara, and Grahani. Grahani with Pandu, if the patient comes to your clinic with Grahani with Pandu and then with Shwasa, okay? So Amlapitta anta ಇದೆ ಇರುತ್ತೆ. Amlapitta will lead to Grahani, then Grahani will lead to Shwasa, and then both of the things will be having a Pandu as symptoms. In these cases, so with these five symptoms, patient come to your clinic, directly you can prescribe only one medicine, Panchamrita Bhatpadi. Okay, disease may be five, but medicine will be one. That is the drug selection criteria. So the disease will origin with Agnimadya, then Ama, then Amlapitta, then it will lead to Grahani. Grahani leads to malabsorption of nutrition. Malabsorption of iron leads to the Pandu. So low hemoglobin level will lead to Shwasa. Arokhanajanya Shwasa is the clinical symptom of Pandu. That will lead to Shwasa. So all this is a single disease, Agnimadya. Got it? How it will start? So directly Pandu will not start. Pandu will start with Agnimadya. Agnimadya, Ama, Grahani, Amlapitta, then it will lead to the Pandu. Pandu will lead to Shwasa. Okay, so link we need to find it out. So if just treating a Pandu in this case, it won't help. Just by prescribing an iron supplement, it won't help. Got it? Iron, by just putting an iron injections. So I have seen some patients. So they have anemia since 10 years, 15 years. And they have transfused with some 2 to 3 bottles of blood 3 4 times in last 10 years. Almost in a year they are used to take iron injections and iron tablets, but still anemia was not treated. Anemia was not come down. Then question mark, why? They have treated only the symptom. They have not treated any disease. Got it? They have not at all correct the Agni. They have not at all correct the Grahani. They have not at all correct the Pandu. They are just replacing the supplement, replacing the iron. Iron replace ಮಾಡಿದ್ರೆ disease ಎಲ್ಲ ಹೋಗುತ್ತೆ. 10 years, 15 years ಇಂದ ಇದ್ದಾರೆ. Okay, here you want to cure the disease means we need to find the root cause. ನಿಧಾನ we need to think. ಮೊನ್ನೆ ಕೂಡ ಒಂದು patient ಬಂದಿತ್ತು. Her age is just 24 years. Since last 10 years, she is suffering with anemia from 9th standard. So during 9th standard, our blood hemoglobin level is 7. During that time only blood transfusion was done. And then after 2 years, again blood transfusion. After 2 years, again blood transfusion. All over the year, she used to take iron injections and tablets. But still, it is not corrected. They come to my clinic, we need to marry her. So you have to correct her problem, then we will plan for marriage. Okay. So finally, they find that solution. Finding a doctor. So next, bola for body. And she will have giddiness and fall many times also because of Pandu. Parada Gandaka. And one more thing in the body, if we allow the body to correct itself, it will try to correct. Otherwise, if you supplement, if you do the supplementation, blood transfusion and all, it won't correct by itself. Again and again, it will ask the same thing. Once you do the blood transfusion in anemia, in emergency we can do it. When the hemoglobin is 8.5 and 9, people advise for blood transfusion. No need. If it is below 6 or if it is in margin from 5 to 6, we can advise. But at the 8, 8.5, 9 also they will advise blood transfusion. Okay, so in that case, body won't prepare proper hemoglobin. Okay, and transfused hemoglobin will be destroyed faster. So within 1 or 2 months, 120 days is the lifespan of RBCs. So usually transfused RBCs will be died early. So body will kill it faster. Body will think it is not our hemoglobin. So it will going to kill. Just like neonatal jaundice. What happens in neonatal jaundice? So baby liver and spleen and as well as bone marrow will going to kill mother RBCs. That is the cause for neonatal jaundice. Whatever the blood came from the mother, it will going to destroy within 20 to 40 days. Peak will be from 2 to 12th day. That is the cause for neonatal jaundice. It's very common criteria. In same, body mechanism is fixed. Okay. So I will advise for proper understanding of a disease and proper analysis, we need to study physiology and biochemistry. So not Kaya. So if you study Kaya without physiology and biochemistry, studying of Kaya is waste. There is no connection between the dots. If you want to connect between the dots, the main key or password is anatomy and physiology biochemistry. Unfortunately, we don't have biochemistry in our curriculum. So next, Bola Parpati. Bola Churna, 2 parts. Bharata Gandaka. So this medicine can be advised 150 to 500 gram. So main indication is Rakta Tisara, Rakta Pitta, Rakta Pradara, Raktarsha. Rakta Tisara, Rakta Pitta, Rakta Pradara, Raktarsha. So in my clinical practice, I won't get result from this Bola Parpati or Bola Churna. I don't know why the preparation may be that wrong. I have tried in many patients, especially in Pradara. Pradara during the menopausal age is okay, but in other patients, just like DUB at the age of 35 years or 38 years, that is not the age of menopause. Dysfunctional uterine bleeding. So at that time, in allopathy, they will do hormone replacement therapies for 3 months and 4 months. So continuous hormone medicines they will give. If it is not subside, then they will advise for operation. There is a common criteria. Okay. So first look of choice is they will give you some coagulants, anticoagulants, pass and muff. So and then hormones. So single hormone, multiple hormone therapy. Okay. So then it won't subsides. Final option will be operation. So patients will come after they will advise operation. Okay. So then what we have to do? If you advise bola parpati or recta so uh, result is very less comparatively. So then we will plan for virage. Virechana, definitely you should plan with Falagruta only, no other medicines. Falagruta, Sukumaragrota. So we have very good results with Falagruta. We use anticoagulants of like these medicines. The Bola Parpati, Bola Churana, Bola Badarasa. Okay. So with any of these medicines, we want to get result, then we should switch on to virage. So in many patients, they were not willing for variation. They were advised only Falagrota Pana. Morning 10 ml, afternoon 10 ml, evening 10 ml. The main key ingredient of Falagrota is Hingu. If you smell Falagrota, you will get a Hingu smell. Otherwise, don't use that company of Falagrota. Okay, after smelling, it smells like an Hingu. And key ingredient in Rajapravartini also Hingu. If you smell Rajapravartini, you should smell Hingu. Otherwise, don't use that company Rajapravartini. Okay. So Hingu is an antispasmodic drug, and as well as it will correct granias. Okay. So the main nutrition deficiencies will be sorted out by Hingu, and also it will act on Ekrut and Rutka. In both the way, it will act Hingu-based medicine. So all our hormones are made up of lipoproteins, lipid and as well as protein. So why our acharyas prescribe Gruta in Pradhana? Okay, so Artha Vikaradalli. So if you just go through the indications and formulations in Artava and Pradhana Vikara, major formulations are Grutas. Okay, Falagruta is one of the indication of Falagruta, Shatavari Gruta, Kumara Gruta. So Ashota Gruta, Ukshura Gruta. So Paishachika, Paishachika, even Panchagavya Gruta. So many grutas are indicated. So Google Tikta is also one indication is there. In Falagruta, definitely it is act as a lipid and as well as protein, and it will helpful in preparing a new hormones to the body. So whatever the approach from modern, their approach is straight and only symptomatic. They will not think of correcting the cause. They will think of correcting the symptoms only. Anticoagulants won't work. Fast injections won't work. Okay, anticoagulants only that will stop bleeding. So what is the cause for bleeding? They won't check it out. They won't think about it also. They were not thought to treat the cause. They are thought to treat only the symptoms. Okay. Here you can give a assurance and Falagrotha definitely will work. And why I advise Virechana Pradhara is because of Pitta Vikruta. So Virechana is the one thing that will correct Pitta. And proper Vatanalomana can be achieved by doing Virechana, Snigdha Virechana. Okay. So Apanavata is responsible for this pradhara, and Apanavata Vikruti is the main cause. So it has a virtue towards this, and we need to redirect Vata towards the inner region according to our things. And if you go with biochemistry and physiology, so all Brutas are lipoproteins. It will fully correct formation of Agni and as well as correct formations of hormones. So finally, the things will be sorted out. And other two strong drugs in case of Pradhara is Durvasvarasa. Let's say patient is very away from city and is on-call patient. So they won't get any Gruta, they won't willing for Virechana. Then what other things can be done in case of Pradhara? It's emergency. By taking all these medicines also it won't come down. Then the next drug of choice is Durva. Durvasvarasa. Durva ಎಂದ್ರೆ ಏನು ಯಾವ ಹುಲ್ಲು ಗರಿಕೆ ಹುಲ್ಲು ಸೊ ವಿಘ್ನೇಶ ಪ್ರಿಯ ಗಣೇಶ ಪ್ರಿಯ ಗರಿಕೆ ಹುಲ್ಲು ಗಣೇಶನಿಗೆ ಕೊಡ್ತಿರಲ್ಲ ಸೊ ಸೇಮ್ ಗರಿಕೆ is Durva. So we can use Durva Swarasa in case of Pradhara. It's the best drug of choice. Durva Swarasa we can advise along with Kalsakre, along with rock salt or tender coconut water. Along with Gruta also we can use Durva Swarasa. So it will helpful. One thing. Next drug of choice is Ashoka. We can use Ashoka, Gruta, Ashoka Kashaya, or Ashoka Arishta. So here you should use loading doses, not 10 ml or 15 ml, at least 20 ml to 48 ml in a single dose. Because the disease is very severe. Bala bala. We need to think the bala of a patient and bala of a disease, both. So my students called me, sir, you told Ashoka Arishta, I have given Ashoka Arishta. Bleeding was not stopped. Then I asked, how much quantity you have given? 10 ml bleeding. After 1 month also it was stopped. I told him. So minimum 20 to 48 ml in a loading dose. 1 or 2 doses should be loading doses. 3-4 times. Even modern also, if patient comes to emergency, they will give you loading dose of antibiotics. Even antibiotic indication is 500 mg, they will give you 1000 mg. Because of sepsis, they should give a loading dose. our students will practice allopathy hospital and they are giving loading doses. When come to Ayurveda, they will forget everything. Bala bala they will forget. So then I will told them what is the loading dose of antibiotic in so and so patients. Then they will tell yes, it's 1,000. Here also we have to give a loading dose of medicines. High amount of higher dose of medicines only work. Okay. So then one more drug of choice is Vasa. Vasa Swarasa. So you think about Vasa, the role of Vasa. Vasa is Rakta Pittahara. It's explained in Agraya. Vasa is Rakta Pittahara explained in Agraya. So a Rakta Pittahara means you think that of only epistasis or bleeding from lungs or bleeding from mouth. So is Urdu Rakta Pittala also, Adogata Rakta Pittara also. Vasa is both Urdhvagata and as well as Adavata Raktapitta. Here you can use Vasa. Swarasa is best drug of choice. If it is not available, then we can think of Vasa Arishta, Vasa Kava, Lehya. But in Lehya and Arishta, the quantity of Vasa is less. Better go with Vasa Swarasa. And then again, one question comes: Vasa Swarasa is Vasa Putapakva Swarasa. Vasa Swarasa is not easily available. Then how to extract Swarasa from Vasa? Easy method. Just keep Vasas in steam while boiling something else. Just keep Vasa above the keep in the cloth and just keep above the steam while preparing the rice or while boiling something else. Just keep Vasa or just plain water also. So keep water in the vessel and in the top tie with a cloth and just keep Vasas. Just give steam for 10 to 15 minutes. Easily we can extract Swarasa from Vasa. No need of giving Putapa Sarasa. But here you will get some little quantities of Sarasa. It's more than enough. 10 to 20 ml of Sarasa is enough. Single dose. And many of my patients are practicing this Vasa Sarasa in Pradharam. They are getting very good results. But this is symptomatic. Vasa Sarasa, Duro Sarasa is symptomatic relief in coagulation. So then we should think about Apanubhava Chikitsa, in case of Virechana or else. We should correct Datvagni Mandya, Rasa Datvagni Mandya. Why I am telling Rasa is very clear. So Upadata of Rasa is Tanya and Artha. The portion of Tanya and Artha is from Rasa Datva. Here you need to correct Rasa Datvagni only. Okay. So Rasa Pachakas only can use and Rakta Pachakas only can use. So by using Rasa Pachakas only, it will get corrected. So drug of choice in case of Pradhara is first can use Falagruta, then Durvasvarasa, Ashoka, and Vasa. Bola Baddha Parvati, Bola Baddha Rasa. In addition, we can give it. When come to patent medicines, Himalaya Stiplan tablet is available, and Imil company Amistop tablet is available. If it is severe Pitta, we can use Kamaduga Rasa also along with that, and Mukta also we can use Mukta Basma, Pravala Basma, Pravala Pishti, and the drug what I told, Amistop, it contains Kamaduga Rasa, Mukta, Pravala. So all Shita Aushadis. Shitam, what is the application of Shita here? So in Padartha Vijnana, we studied Yasya Stambhana Shakti Sa Shitaha. Where to apply? Here. Bleeding is there. We need to do Stambhana. For Stambhana, we have to use Shita medicines. What are the Shita medicines available? Kamadaga is Shita, Mukta is Shita, Pravala is Shita, Pishti is Shita, Pravala Pishti is Shita. So we need to enforce Shita Dravyas. Durva is Shita. Okay. So this is the way application of Padartha Vijnana in Prasuti. Application of Dravya Guna in Prasuti. Application of Rasashastra in Prasuti. Otherwise, you won't learn. So this is the way we should learn from our colleges. Where to apply, how to apply, what is the utility of Shita Guna, Shita Guna. So if the colleges thought like in that way, it's easy to practice. But still, our students are struggling to practice Ayurveda because we are not taught on these basis. So not in any college. I'm not blaming the one or two colleges. In 99% of the colleges, they won't taught clinical medicine, applicable medicine. They will taught only the syllabus. Syllabus won't help if Jara patients comes. If you recite a Jara shloka, Jara will not go. Okay. So clinical applicability is different. Clinical medicine is different. So in MBBS colleges, just visit MBBS colleges. Their third year and final year classrooms are attached to the OPDs, are attached to the IPDs, not OPDs. Here is the ward, and beside the ward only they have a classroom. Okay, even in Prasuti Siloga also, even the attached classrooms will be there everywhere. Wherever you can see there is attached classrooms. So morning 3 hours they should go and visit the patients and they should do all the things. And afternoon they will take class in the adjacent classrooms. The teachers, everybody will be there in the same premises. They will taught them. So that is practical learning. Here, what happens in Ayurveda, we will learn theory, but you won't apply practically. That is a drawback. So there it's ulta. In MBBS, it is ulta. First they will see the patient, then they will learn. They will study. In Ayurveda, completely theory, no applicability. That is a drawback in Ayurveda curriculum. We will correct all these things. We don't know. Still no improvements, no corrections. Still they are giving permissions for many Ayurveda new colleges. Okay. Maybe we'll correct it. Don't worry. Next, Vijay Parpati. Amistap is also having a very good action. It contains all Shita. Amistap, Amistap, Stiplar. And one more drug of choice and the best drug of choice is Nagakesa. Excellent drug. Stambhana action. Nagakesa. Nagakesara churna, I will advise Nagakesara churna with butter. Nagakesara churna with butter. So here the disease is Atyayika and emergency disease. Here we should advise medicines muhur muhur. Frequently will advise it. Some 3 to 5 grams of churna with 10 grams of butter. Every half an hour, 1 hour, 2 hours. So depending on the severity. So I will advise the patient if they change the pad for 2 hours once, you should use medicines once in an hour. If you change the pad for once in 3 hours, twice in 3 hours, 1.5 hours once you have to use medicines. If you use pad once in 6 hours, so you can use medicine once in 3 hours. Okay, got the calculation. One pad count is minimum 30 to 50 ml of blood in severe cases, not in regular measures. I'm not telling in regular patients. Regular patient overall bleeding will be around some 50 to 80 ml. In Pradhara, in a day, they will bleed more than 100 ml. Okay, so that is the level of understanding and the dosage fixation depends. Okay. Menstrual cup use quantity I cannot tell, but they will tell the quantity some 20 ml, 30 ml. So within 3 hours, 6 hours, I need to change the cup like that. They will tell. Based on that, we can give the medicines. Vijay Parpati. Raupya, Mukta, Swarna, Vaikranta. Ingredients. Raupya, Mukta, Swarna, Vaikranta. So Vijay Parpati is such a strong drug. Here we have Vaikranta, we have a Swarna, we have a Raupya and Mukta Vasma. Here we should think about some intestinal CAs, some intestinal nodules or extra growths in GI tract. In this case, we can use Vijay Parpati. And here the key ingredient is Vikranta. Vikranta is an excellent drug in case of any tumors. Okay, so first drug of choice is Vajra. Vajra Labhya Vikranta. Easily available and cost effective. Vajra 100 milligrams, 100 milligrams is 1000 rupees. Vikranta 100 milligrams is 3 rupees. 1 gram of Vikranta not costing more than 100 rupees. 3 to 10 rupees. 100. So Vikranta is an excellent drug of choice in case of tumors, even in case of fibroadenoma, fibroid uterus, fibroadenoma of breast. So any other unwanted tumors also we can use Vikranta. So here in Grahani with these tumors or any hernia, in that case also we can use. So Raupya, Mukta, Swarna and Vikranta, Paradagandaka is the key ingredients. Here instead of Paradagandaka directly they use Rasindura. Rasindura means Paradagandaka. Paradagandaka preparation is Rasindura. This indication is Asadhya Grahani, Amashula, Amatisara, Asadhya Grahani, Amashula, Amatisara. 6 types of arshas. It will cure all types of arshas also. So next is the Shweta Parpati or Kshara Parpati. So it contains Suryakshara, Spatika, Navasagara, Suryakshara, Spatika, Navasagara, Navasagara. So it's the best alkalizer. Okay, it can be used in case of Mutrashmari, Shweta Pradara, Mutakuchra. It will Paradanilla Gandakanoid. Okay, it's an alkali, Kshara Parpati. So uterine ಕೂಡ ನಾವು ಯೂಸ್ ಮಾಡೋ urinary tract infection, urinary calculi. In that case, we can use Shweta Parpati. Shweta Parpati is also known as Kshara Parpati, Shubhra Parpati. Same. Shweta Parpati is also called as Kshara Parpati or Shubhra Parpati. Next is Gagana Parpati. Gagana is a synonym of Abraka. Okay. Gagana is a synonym of Abraka. Parana 2 parts, Gandaka 2 parts, Abraka 1 part. So your direct indication is Kasa, Shaya, Shwasa, Grahana. Complication of Grahana is Kasa, Shwasa, and Shaya. In that case, you can use breakup property also. And in one more case, Kasa, Shwasa will lead to Grahani. In that case also, you can use Gagana property. So this completes Parpati Kalpanas. Next, we'll go with some Kalvi Rasayanas, some important Kalvi Rasayanas and their preparations and their indications. Take 2 minutes break. Now it is 5:38. We will start again by 5:40. Okay, we'll start Kalvi Rasayanas. Main action of Kalvi Rasayanas are Srotomukha Vishodhanas. So here, Srotas is not only the Mahasrotas, we should think about all the Srotas in the body. Okay. Charaka Srotas. How many Srotas are according to Charaka? So Shruta 11 pairs, Charaka 13. Okay. All minute, major, and minor channels. So it has an affinity to cleanse all major and minor processes, including cell. Cell is also being considered as a mool of sources. Okay, complete detoxification will be done. So when we thought about Rasashastra, these medicines will do the effect of panchakarmas. Apanarbhava chikitsa is not only the panchakarma. So with medicines also we can do apanarbhava. We can with medicines also we can give a rasayana. Rasayana is not only lekha rasayanas. We have a rasa rasayanas also. Rasaushadhis will act as a rasayana. Swarna Bhasma is a rasayana. Ropya Bhasma is a rasayana. Okay, Abraka Bhasma is a rasayana. Okay. So Channa Prabhavati not only Shamana Aushadhi, it is a rasayana. Shilajit is a rasayana. Ikande Shilajit. Radhashan Gugulu is a rasayana. Though it is a Gugulu, but action is rasayana action. Boksharadi Gugulu is not only Gugulu, it is act as a rasayana. Okay. So the mindset we have in UG studies is Rasayana means only Lekha Rasayanas. Those are the drugs explained in Rasayana, there is a Rasayana. But single herbs is also act as a Rasayana. So in any chapter, if the herb is a single herb is explained, it is a Rasayana for the particular disease. Okay. So Guduchi is a Rasayana in Vatarakta. Gokshura is a Rasayana in all genital urinary tract infections and genital urinary tract deformities. So Varana can be used in any case of Antarvidradi. It's a drug of choice in any case of Antarvidradi and it acts as a Rasayana in other way. Repetition. If we want to stop repetition of Antarvidradi, we can continuously give Varuda, single drug. Okay, don't think that only Ashwagandha is Rasayana, Shatavari is Rasayana, Amalaki is only the Rasayana, Haritaki is only the Rasayana. Rasayana, the concept is very broad and wide. So anything can be the Rasayana. Okay, here it's a Rasa Rasayana. So Kalvi Rasayanas. So it will act as a Srotomukha Vishwarana. Right? So some examples of Kalvi Rasayanas, Tribhuna Kirti, Lagusutta Shekara, okay, Ananda Bhairava Rasa, Inguleshwara, Shwasakota Rasa, Kumara Kandana, Arakyavardhini, Saptamtalava. So this is Mutyunjaya Rasa. So these are all Kalvi, some examples of Kalvi Rasayanas. Okay. So first we'll start with Shwasakota Rasa. Shwasakota Rasa. So ingredients are Parada, Gandhaka, Vatsanaba, Tankana, Parada, Gandhaka, Vatsanaba, Tankana, Maricha, Shunti, Pippali, Manashila. Okay. Parada, Gandhaka, Tankana, Vatsanaba. So Shunti, Maricha, Pippali is Trikatu along with Manashila. Wherever you see Vatsanava, definitely you should see Tankana as one of the ingredient in the formulation. The antidote for Vatsanava is Tankana. Okay, so very common thing. So you should observe everywhere. So wherever we can see Vatsanava, definitely we'll see Tankana. So antidote of Vatsanava is here you can observe two Vishas are present in Shwasakotaras. One is Vatsanava, one more is Manashila. One is herbal poison, one more is mineral poison. Both the things will be purified and used in the preparation, but still we can think two poison drugs are there. So all the Rasashastras are we are using with the minimum doses. Okay, the main benefit of using Rasashastras are we are using with a small matras. Same thing if you advise the churna, it is 12 grams. Kashayas, so 50 to 48 ml. So Lekyas, 10 to 20, 25 grams, up to 48 grams also we can use Lekyas. Okay, any other medicines. So any caste Aushadhis if you are using, normal caste Aushadhis, the dose will be higher. Here Rasa Aushadhis dose are very less. 1 rati to 2 rati maximum dose. In divided doses are once in a day. Okay. So the main advantage of using Rasashastras is we are using very less dose of medicines and the result will be ultimate. Okay. So whenever you think about Swasakotara, you should think about Vasanava and as well as Manashila, two Visha Dravyas are there. Definitely will get a very good results. Though it has minimum toxicity in the body, uh, don't use continuously for years together. Swasakotara, any drugs contains Visha. So one mandala you can give some gap of 5 to 7 days. Again, you can restart the medicines. Up to 3 months you can give. So then you can stop medicines for 3 to 5 days. Again, we restart. So that is the better thing. So body should rejuvenate it. Then we can start the same medicines. Okay. So Trika 2, Vatsanaba, Parada Gandhaka, and Manashul are the main drugs. Here Bhavana with Ardhaka Swarasa. Bhavana is with Ardhaka Swarasa. So 2 to 4 rati is the dose. Anupana is Ardhaka Swarasa or Nagavali Swarasa. Ardhaka or Nagavali Swarasa. Indications Kasa, Shwasa, Pratishaya, Ekshma Jwara. Shwasa, Kasa, Pratishaya, Ekshma Jwara. Shwasa, Kasa, Pratishaya, Ekshma and Jwara. Next, Vasanta Malini Rasa. Vasanta Malini Rasa. Vasanta Malini Rasa. It's also called as Swarna Vasanta Malini. Anything, it will start with Vasanta. These are all Rasayanas. ವಸಂತ ಅಂತ ಇಲ್ಲೆಲ್ಲ ಸ್ಟಾರ್ಟ್ ಆಗಿರುತ್ತೆ ಅವೆಲ್ಲ ಸ್ವಲ್ಪ ರಸಾಯನ. ಸೊ ಜ್ವರಾಧಿಕಾರ ವಸಂತ ಮಾಲಿನ್ಯ ರಸ ಇಸ್ ಜ್ವರಾಧಿಕಾರ. ಶ್ವಾಸಕೋಟ ರಸ ಇಸ್ ಶ್ವಾಸಾಧಿಕಾರ. Adhikara means in which disease these medicines are explained is adhikara. Indications may be many, but the disease in the chapter these medicines are explained is adhikara. So it contains Varnavasma, Ingula 3 parts, Maricha 4 parts, Muktavasma 2 parts, Karpura 8 parts. Swarna, Ingula, Maricha, Muktabhasma. Swarna and Mukta both drugs are there. Okay. So here Mardana with Navanita and Nimbus Varasa Bhavana. Okay. Mardana with Navanita and as well as Nimbus Varasa. Butter used here for the Bhavana. Butter. Okay. Anupana is Madhu or Pipali Churan. Madhu or Pipali Churna, both you can use. Madhu and Pipali Churna both can be used as an Anupanas. Okay. Jirna Vishama Jwara or Purana Jwara. Jirna Vishama Jwara or Purana Jwara. These medicine can be used in acute fever. It's very clearly they are given Vishama Jwara or Jirna Jwara. So Swarnavasma preparations can be used in acute conditions. From my clinical experience. So Rasayanas will come after acute therapy ಆದ್ಮೇಲೆ then you can go with Rasayanas. So Vaslamalin is a Rasayana. Next Lokanatha Rasa. Lokanatha Rasa. Indication is Atisara. Lokanatha Rasa. Indication is Atisara. Adhikara is also Atisara. Parada, Rasa Sindura, Gandhaka, Tankana, main indication is Amla Pitta, Parinama, and one of the ingredients is Varatica. It also contains Varatica. Amla Pitta, Parinama Shurla, Atisara, Udara Shurla. Amla Pitta, Parinama Shurla, Atisara, Udara Shurla. Next is Mukta Pravala Panchamrita. Mukta Pravala Panchamrita. So whatever the drug you will see, Pravala Panchamrita is not only the Pravala Panchamrita, it is always associated with Mukta. So manufacturer companies, they will bring up two medicines. One is plain Pravala Panchamrita, it doesn't contain Mukta. One more medicine is Mukta Pravala Panchamrita. Mukta Pravala Panchamrita cost of 30 tablets is 450. Plain Pravala Panchamrita cost of each tablet is around 4 to 5 rupees. Okay, so classically in text, what we have is only single drug. Mukta Pravala Panchamrita is the classical explanation. There is no plain Pravala Panchamrita explained in classics. And even in Sudashekara also. Sudashekara means with gold only. Sudashekara will come with gold only. That is the classical explanation. Without gold, Sudashekara is not our classical version. It is company versions. Manufacturer company made that one. So 30 tablets of Sudashekara with gold costing about 1200. So plain Sudashekara will costing about for 30 tablets 100 rupees. So they make it as a cost effective but without adding gold. If you want a result, we should go with gold only. Sudashekara is indicated in many diseases, for instance, Amlapitta, Parinamashula, Yakrutvikara, and even in it has it acts as a rasayana because it contains a swarna, and mainly Sudashekara will use in case of ama conditions. Okay, without ama we'll go with Kamadaga. So peptic ulcer conditions only we'll go with Kamadaga directly. But the purpose of using Sudashekara, it consists of ama and as well as it acts as a rasayana. So we need gold in that condition. Plain Sudashekara is drug will work definitely, but that much of result you won't get it. Swarna is the one that will enhances the potency of other medicines in the formulation. So directly. Hangagi, while using the formulations, you should be cautious and you should see pocket friendly also. If you need Swarna Sudashekara, you can advise. Or else only 10 days you can use Swarna Sudashekara, after that you can make it a plain. Instant result and followed by without gold. Like that also we can manage patients. So Mukta Pravala Panchamrita, Mukta is one part, Pravala is two parts. Shanka is one part, Shukti is one part, Kapardika. So Bhavana with Arthadabda. After doing Bhavana, so this Mukta Pravala Panchamrita should apply Puta. Okay. So after Puta only we can use this Mukta Pravala Panchamrita. So without Puta we cannot use. So this, though it is a Kalvirasana, after Puta we will again try to get it, we will make the medicines. Mukta Pravala Panchamrita. Matra is 2 Gunja. Reference is Yogaratnakara. Reference is Yogaratnakara. Gulmadikar. Okay. So indications Udara, Amla Pitta, Pliha Vikara, Atisara, Grahani. Atisara, Grahani. 1 minute. Okay. So Mukta Pravala Panchamrita here you can see all ingredients are Shukta Kalpanas. So Yaudu calcium compounds. Okay. So Shanka ide, Shukti ide, Kaparda ide, right? Pravala. So these medicine can be used in case of Astivikara also. So it will start with uh, Udara, Grahani, Asti. So you can use it in Amla Pitta, Grahani, then Astikshaya. Okay. So those who are intention to grow their height before 12 years of age or before 14 years of age, don't ask after 20 years. Okay. So this drug of choice we can use. It will do Asti Poshana very well by supporting intestine. Absorption will be very good in the intestine. Mukta Prala Panchamrita. Same drug. So 1 to 2 Gunja. Udara, Amlapitta, Pliha Vikara, Atisara, Grahani, Shwasakasa also it will work. So Yoga Ratnakara, it is there in Gulmadikar. Gulma. Again, Sudashekar Rasa, Amlapitta. So Mukta Prala Panchamrita costly and just will give Asti Madhya Pachakas or Sarvadata Pachaka, Chitragadi, what we can use, and Ashwagandha. Ashwagandha is Asti Kasayana. And that's Asti can use. Amlapitta. So Sutashekara rasa contains shunti, maricha, pippali. So many ingredients are there. Shunti, maricha, pippali, trikatu. Directly you can write. Parada gandaka. Shanka is present. Chaturjata is also present. So Tankana is there. Dattura bija. Swarnavasma. Bhavana with Brungaraja Sarasa. One formulation Vasana by one formulation Vasana by La. We have a lot of formulations in the name of Sutashekara. In some others, it's Vasanaba is one of the ingredients. Vasanama and Tankana. Swarnavasma and Tamarvasma. Okay, Parada and Gandaka. Trikaton Chaturjata. So because of Trikaton Chaturjata, Amapachara will be happens very fast. So appetite will increases. And then Swarna and Tamra will act as a rasayanas. And Amadoshahara also. So finally, Dushi Vishahara action also we can expect from Tamra and Swarnavasma. ಸೊ ದೂಷಿ ವಿಷಯದಲ್ಲಿ ವಿತ್ ತಾಮ್ರ ಮತ್ತೆ ಸ್ವರ್ಣ ವಮನ ಹೇಳ್ತಾರೆ ಒನ್ ಕ್ಷಣ ಆಫ್ ಸ್ವರ್ಣವಸ್ಮ ಅಂಡ್ ತಾಮ್ರವಸ್ಮ ಸೊ ಅಡ್ವೈಸ್ ಟು ಡೂ ವಮನ ಇನ್ ದಟ್ ಕೇಸ್ ಆಲ್ಸೋ ಇಟ್ ವಿಲ್ ಹೆಲ್ಪ್ ಸೊ ಸ್ವರ್ಣ ಸುತಶೇಖರ ಮೀನ್ಸ್ ಇಟ್ ಇಸ್ ಎ ಸ್ವರ್ಣ ಸುತಶೇಖರ ಅಂಡ್ ಇಯರ್ ಮೇನ್ ಡ್ರಗ್ ಆಫ್ ಚಾಯ್ಸ್ ಅಂಡ್ ಆಕ್ಷನ್ ಎಕ್ಸ್ಪೆಕ್ಟೆಡ್ ಫ್ರಮ್ ಭೃಂಗರಾಜ ಸೊ ಆಲ್ವೇಸ್ ಭಾವನ ದ್ರವ್ಯ ಈಸ್ ಡಬಲ್ ದ ಕ್ವಾಂಟಿಟಿ ಆಫ್ ದ ಮೇನ್ ಇಂಗ್ರೀಡಿಯಂಟ್ಸ್. So trituration, some formulations they will tell only 1 day or 2 days or 3 days or 7 days or 21 times bhavana. So like that bhavana will be increases. If you want to more potensify the medicine, we should give more times of bhavana. Okay, continuous trituration for 3 days, 5 days, 7 days, the drug will become more potensified. So in case of hepatotoxicity and amlapitta with hepatotoxicity, the Brungaraja Sarasa and Sushikara is a drug of choice. In case of hepatic encephalopathies, in case of cirrhosis, hepatitis, so directly we can use Sushikara as drug of choice. Not only it is limited to amlapitta or only esophageal ulcers and peptic ulcers, and limited to gastroenteritis or gastritis, hyperhydrochlorua, increased acid levels. So it has some very good results with liver disease also. And even it will act on the brain also. Brungaraja is a drug. It will control vagus nerve activity. So stress-induced gastritis. Okay. So in that case also it will help. So if you are in very anxiety also, acid will releases in extra. If you are in sad mood, so acid level will be decreases. In anxiety, acid level will increases. In sad mood, acid level will decreases. Both will leads to indigestion. Okay, so in that case, this is the good drug of choice. And Brungaraja is such a drug; it will control anxiety neurosis, anxiety-induced this one. So it's a good drug of choice, right? So indications: Amlapitta, Grahani, Atisara, Udavarta, Parinamashula, Shwasa, Kasa, Rajakshma, and Brahma also. So Brahma in case of semi-coma conditions, Sutshekara can be used. Okay. So giddiness, Brahma conditions because of increased ama in the body. Sutshekara is a drug of choice. With the Trikatu, it will act fast. Okay. Still a lot of medicines are there. We will continue. It will take another one day. 1.5 hours. So we'll continue in next class. Okay. And Amlapitta, I need to explain. It will take another half an hour. Amlapitta stages medicines. Okay. We'll continue the next class with Amlapitta and drug of choice in Amlapitta.